Great, thank you. My name is Cary Schlick. I'm a general surgery resident at Northwestern, and I'd like to thank you for the opportunity to share our work today. We have no conflicts of interest to disclose in relation to this project. So, operating surgeon technical skill is associated with postoperative complications, with prior work from our lab showing that variation in surgical technique among practicing surgeons accounts for 27.5% of the variation in complication rates. However, few options exist to support practicing surgeons in improving their technical skills, and continuing medical education opportunities are generally didactic in nature and poorly aligned with adult learning theory, making it difficult for surgeons to implement new ideas into their daily practice. We have previously tried to address this gap via a quality improvement program in which surgeons across the Illinois Surgical Quality Improvement Collaborative have been working on a video-based coaching. In this project, participating surgeons have been able to upload operations that they have performed and then receive numerical score reports from their peers. This is followed by in-person peer-to-peer feedback sessions that are focused on areas for improvement. We found that the participants greatly enjoyed getting feedback from their peers. However, surgeons themselves don't have any formal training in providing feedback. And so although it was easy for surgeons to give feedback such as, "I don't like that," or "good job," it was more difficult for them to give specific instructions on things that they could improve. Furthermore, we wanted to ask our participants what they enjoyed and did not enjoy about the sessions, and the feedback was largely positive. They indicated that they don't feel so isolated when they're able to discuss their cases with their colleagues, and furthermore, they saw new ways of doing things that changed their techniques, and reviewing their own videos specifically allowed them to find ways in which they could improve. However, there were some suggestions for improvement, and that it included that it was difficult for participants to arrange their schedules so that they could meet in person, and that it would be more convenient for them to review the videos on their own time so that they wouldn't have to follow this organized structure. Furthermore, in this pilot project that we did, participants received numerical score reports via a validated score called OSATs, in which participants received scores on a scale of 1 to 5 in several domains, such as respect for tissue, time and motion, or instrument handling. And although this seems like it would be helpful if a participant receives a score of 3, for example, on respect for tissue, it's hard for them to know what that means and what they could do in order to become a 4, or what prevented them from being a 2. So with all of this in mind, we sought to develop a new platform that would be a safe remote learning environment for practicing surgeons to improve existing techniques and learn new surgical skills through structured peer feedback, and secondarily to implement CME accreditation to compensate participants for their time. And so from those ideas, we developed Vista, which stands for Video-Based Feedback for the Improvement of Surgical Technique, and this is a secure web-based forum to support improvement of technical skills. So participants can record and upload their operative videos for which they would like to receive feedback, and then the site facilitates self-assessment and peer feedback. And standardized training ensures that actionable, constructive, and procedure-specific feedback is shared. And then participants can incorporate the feedback and repeat the process to support their surgical learning. So our website is live. We encourage you to visit us at vistavideos.org. If you're excited by this idea, definitely check it out. I think that you will learn some more about our program and hopefully decide to join us. So I wanted to share a few screenshots of what our site looks like and highlight a few things. So you can see right here on our homepage that this is a site that is made by surgeons for surgeons. And you can read our mission that Vista is a free video sharing platform for attending surgeons to give and receive operative feedback to improve their surgical skills and simultaneously obtain CME. And I wanted to point out that this is a closed site, so participants must register in order to use the platform. And this is a way for us to ensure that you're a practicing surgeon and that there aren't bystanders who are trying to get access to the videos. And then once you're gained access, you're able to use the processes we've described so that you can record operations, submit the videos, and then provide feedback and learn from your peers, and then incorporate the feedback to improve and repeat the cycle. And then I wanted to circle back to the point that I made earlier about how giving feedback is not something that we are naturally good at as surgeons. And so there are specific modules that are embedded into the website that train surgeons in how to give feedback that is actionable and goal-directed. And this helps to shy away from giving people numerical scores and instead give them actionable ideas that they can learn from. And the feedback reports are double-blinded, meaning that the person who is reviewing the video doesn't know who the operating surgeon is, and furthermore, the person who receives the report doesn't know who graded them. And so this allows everyone to be treated as an expert, but the feedback to remain honest. Currently, the site is supporting 5 operations, including laparoscopic appendectomy, cholecystectomy, laparoscopic inguinal hernia repair via the TEP and the TAP approach, as well as laparoscopic ventral hernia repair. But we are actively expanding and hope to support many more operations in the near future. And as I mentioned, participants receive CME hours concordant with the amount of time that they spend interacting with the site, and these are distributed by Northwestern University on a quarterly basis. And in the future, we hope to increase the accessibility to all surgeons. That's why we're sharing this project with you today. And as I mentioned, we'd like to expand to include other procedures in the near future. And this project was really grown from our own ideas from the ground up, and we've gotten a lot of feedback along the way from our users to help us to grow and expand, and we hope to do that in the future as we continue. So in conclusion, Vista is a recently released platform to support improvement in surgical technique, and we hope that you will join us, and we look forward to improving together. So we welcome your feedback. You can email me or tweet at me here at Cary Schlick. We'd like to thank the team of people that have made this platform possible, and I welcome any questions you may have.